Hello, I am Dr. Corey King from AskDrKing.com. Today we're going to be discussing whether or not you should have your thyroid gland removed. That is a big question that a lot of patients ask me when they consult with me, and I don't always have a great answer because we have to go through some of these priorities. So that's what we're going to discuss on this short video. Make sure to like and share the video because you never know whose life you may change just by sharing some information like this video with them. So, should we have the thyroid gland removed? Well, the first big question is, well, what in the world is going on? The number one cause of nodules in the body is called Hashimoto's disease. That's an autoimmune condition. Nodules, a lot of the times, are the main reason why patients are being told, hey, Mrs. Smith, you need to have your thyroid gland removed. But let's talk about nodules and what they are. Nodules are your body's protective mechanism of trying to preserve your thyroid gland's tissue. So I'll repeat that. Nodules are your body's protective mechanism for trying to preserve your thyroid gland's tissue. So what that means is, in an autoimmune condition like Hashimoto's, it is attacking the thyroid gland. Your thyroid gland in our body, very smart, they're going to try to preserve that thyroid tissue, and they're going to start to develop these shields. Now, these shields can grow on one side of the thyroid or the other, and they can be different sizes, but their job is to try to protect your thyroid. So, why are we going to remove the thyroid with an autoimmune condition? Well, in the traditional medical model, they don't have any type of management plan other than giving you thyroid medication. They're not going to talk to you about managing the Hashimoto's disease. So in a lot of my patients, what we have seen over the years is that when you manage the Hashimoto's condition over here, we're going to start to see the nodules here, in reality they're here, but see the nodules not grow in size, and I've seen the nodules shrink, and I have seen some patients' nodules completely go away. That does not happen on everybody. But a win in my book is if the nodules do not grow in size anymore. That's fantastic. That means the autoimmune condition is being managed properly. Okay? Now, another reason why patients are told to have their thyroid glands removed is because the doctors simply can't manage their condition properly. That one blows my mind. I had a patient share that with me the other day. She said, hey, Dr. King, the doctors are wanting to take out my thyroid gland. And I said, okay, why? Well, because they can't manage it properly. Well, my God, are you going to go to a cardiologist and let's say the cardiologist can't manage your high blood pressure properly with the medications? Is that cardiologist going to recommend taking the heart out and replacing it? No. Why would you take the thyroid gland out because you have an autoimmune condition? If you remove the thyroid, your body still has an autoimmune condition. It will just go and attack other areas like your joints or your nerves or your skin. If you manage it properly, you can keep your thyroid, you can live a kick-butt quality life, but you got to manage the autoimmune condition. Now, the other reason that patients are being told to have their thyroid glands removed is due to the fact that they have cancer. Now, I'm going to support these patients 100%. I will also support these patients 100% if they decide to go the natural route when it comes to managing cancer. So that's a whole different video. But nodules, a lot of the times, they are the reason why the doctors say, hey, Mrs. Smith, we need to biopsy that tissue. Do I agree with the biopsies? Yes and no. There can be side effects of the biopsies. We can spread cells because that needle goes in there and it penetrates it, and if it's cancer, cancer can sometimes spread, but you need to know if it's cancer. Also, I've heard horror stories of patients having really bad biopsies that completely threw off their whole health condition. Now, the biopsies are sometimes a necessary evil to determine if there's cancer. When do I recommend the biopsy? Well, there are red flags in blood work. So if there's a red flag in the blood work, there's a nodule going on, then I'm going to recommend for that patient to get the biopsy done. A majority of the time, if that patient knows that they have Hashimoto's disease and they have the nodules and there are not any red flags, I'm going to tell the patient, look, this is my opinion. This is what's causing the nodules. you can manage that condition properly, try to get the nodules under control, and if you do, fantastic. Right? If that patient decides to get the biopsy done, I'm going to support that as well, because it can be scary being told that you potentially may have cancer. Now, that was told to my mother. She had a full body scan done at this one doctor's office, and he goes, "Oh my gosh, you need to get to an oncologist. It looks like you have thyroid cancer." My mother calls me, rightfully so, just in a panic mode. And I said, "Mom, let's calm down. You've been super healthy your entire life. Let's run some blood work." Her blood work came back almost perfect. If all my patients' blood work came back that way, there wouldn't be anybody for me to help. And I said, "Mom, those nodules are just from an old infection." So infections can cause nodules that can then scare people into getting their thyroid glands removed. Now, let's say if you do get the thyroid removed, let's say you had thyroid cancer, or your doctor talked you into doing it and nobody had taught you better at the point in time. My father does not have a thyroid gland. He had throat cancer many, many moons ago. His doctors accidentally destroyed his thyroid during the cancer treatment. We discovered it years later. I shouldn't say years later. We discovered it a short time after, and within that amount of time, all we did was we simply managed his condition properly. We not only worked on some of the post-cancer symptoms or priorities, if you will, but I put him on a natural thyroid support. My father, at the time of this filming, he is 69 years old. He is one of the pilots that fights all those big forest fires that you see. And when he's not working, he cycles about 150 to 200 miles per week. He's 69 years old. My father is doing fantastic, and he doesn't have a thyroid gland. I just have him on natural thyroid support, and he's doing great. So with that being said, you can still live a kick-butt quality life even if you do not have your thyroid gland. But if you're curious about the fact that your doctors are saying you need to have it removed and you want to talk about some options, you need to go through those priorities that we just discussed. If you'd like to dive into it deeper, simply contact me. You can find us on AskDrKing.com. You can check out our YouTube channel, Ask Dr. King. Visit us on Facebook as well, or just shoot me an email, drking@askdrking.com, and let's see what may be right for you. So until next time, I hope you have a great day and make it a successful day.